Hello, everyone. Thanks for joining our Facebook discussion today to talk about OHA's updated mask guidance. My name is Rudy Owens, and I'm a public information officer with the Health Information Center for the Oregon Health Authority's COVID response. Today, we're joined by Dr. Tom Jeanne, Deputy State Health Officer and Deputy State Epidemiologist at the Oregon Health Authority, who will talk about the newly updated mask guidance in Oregon issued by the Oregon Health Authority, and Michael Wood, Administrator of Oregon Occupational Safety and Health, who will discuss how Oregon OSHA is interpreting the new guidance. After the brief presentations, we will open it up to questions. To ask a question, you'll submit it in writing in the chat section. With that, we'll ask Dr. Jeanne to kick us off.
Thank you, Rudy. So our topic discussion today is new masking guidance for the state of Oregon, which was released on May 18th, soon after the Centers for Disease Control and Prevention updated its guidance nationally for fully vaccinated persons, which we'll explain shortly. So this topic is of great interest to many Oregonians. But before we get into that, I first want to provide you with an update on the status of COVID-19 in Oregon, with some mostly positive trends and reminders of what we still face as a state. Our data we've collected recently clearly shows the latest COVID-19 surge is waning. Last week, we saw a 16% drop in newly reported cases each day, marking the second consecutive week cases have fallen. As of last Friday, our 7-day moving average for daily cases is 486, which is 40% lower than it was on May 1st. This turning point is likely due to multiple factors. Extreme risk protections put the brakes on in counties with the highest infection rates. Warmer weather drew more people outdoors, and most Oregonians continue to wear masks and limit the size and frequency of social gatherings. And most important, more Oregonians have been getting vaccinated every day. Our most recent 7-day rolling average for daily vaccinations is 30,339 as of Monday. And we're seeing an expected dip in the daily numbers as we vaccinated more residents. However, hospitalizations and deaths, which are both the most severe and most tragic outcomes of COVID-19 and the last indicators to change, remain high. Last week, sadly, Oregon recorded 57 COVID-19 deaths. That number is the highest total in 10 weeks. This was a sobering reminder of the threat posed by the virus. Hospitalizations are also still too high, continuing to stress doctors and nurses in ICUs across the state, but it is encouraging to see them coming down. The very good news is we're all on target to pass Governor Brown's goal of vaccinating 70% of all Oregon adults before the end of June. As of last Friday, 63% of Oregonians who are 18 or older have received at least one dose of vaccine. Oregonians are doing their part by protecting themselves, their family, their neighbors, and their communities. More than 2.1 million Oregonians have received at least one dose of the COVID-19 vaccine, and more than 1.7 million Oregonians have completed their vaccination series. That means they've had 2 doses of either Moderna or Pfizer vaccines, or a single dose of the Johnson & Johnson vaccine. To get the full benefit from a vaccine, or to be fully vaccinated, a person would still need to wait 2 weeks after completing the series to achieve that status. So on May 13th, the CDC said, fully vaccinated people can resume activities without wearing a mask or physically distancing, except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local business and workplace guidance. The CDC made clear its decision-making was guided by science and by the state of the pandemic. And the data showing that vaccines being used in the United States and in Oregon are highly effective in protecting persons from becoming sick with SARS-CoV-2, the virus that causes COVID-19. The CDC's announcement also meant that states and other jurisdictions could examine their status and their responses. So on May 18th, OHA published its new masking and physical distancing guidance for Oregon, which brought our guidance into alignment with the CDC's new position. In Oregon, businesses, employers, and faith institutions now have the option to adjust their masking guidance for fully vaccinated individuals. For these individuals, they will no longer need to wear a mask in these establishments. Businesses, employers, and faith institutions must have a policy in place to check the vaccination status of all individuals before they enter their establishment. Businesses, employers, and faith institutions who do not create such policies will maintain masking requirements regardless of an individual's vaccination status. In Oregon, we want to recognize the significant protection that vaccination offers individuals and those around them. We know that many businesses want to be able to offer clients and employees service without masking. So if they have a system to verify vaccination in place, they can do that. If they don't want to check, they can continue to follow the current guidance. We're not expecting businesses or others to check for authenticity of a person's vaccination documentation. We know most Oregonians will be honest and not jeopardize their health or that of others. In addition, we've heard from many people fully vaccinated who've asked when they'll be able to remove their masks. Because of the high level of protection a person has after being fully vaccinated, many can now go out without masks in many settings. We believe these rules will be an incentive to encourage more residents to choose to get vaccinated. However, fully vaccinated persons are still required to wear a mask and observe physical distancing on public transportation and in schools, hospitals and clinics, homeless shelters, youth and adult correctional facilities, and long-term care facilities. OHA still strongly recommends that people who are not vaccinated and people who are at high risk of severe COVID-19 disease continue to wear face coverings and physically distance in outdoor crowded areas and large gatherings, such as sports events, fairs, festivals, parades, graduation ceremonies, or wedding receptions. But all Oregonians can be outside without masks in small gatherings in uncrowded areas. And with that, I'll turn it over to Michael Wood, Oregon OSHA.
Thank you, Dr. Jeanne. So since the pandemic began, Oregon OSHA has brought its enforcement and educational resources to bear to help protect workers from the spread of COVID-19, which does pose a genuine health hazard in the workplace. Our enforcement efforts include the recent extension with slight modifications of the rule we first adopted last November, addressing COVID-19 risks in all Oregon workplaces. Based on the Oregon OSHA requirements and consistent with OHA's updated guidance for fully vaccinated people, we expect employers to ensure the facial covering and physical distancing requirements are followed. As spelled out in the updated OHA guidance, if employers choose to allow either employees or visitors to come into the workplace without a mask or physical distancing to use the vaccine exemption, they can excuse them from the facial covering and physical distancing requirements, as long as they verify those individuals' vaccination status. If a person claims to be vaccinated but refuses to provide verification of vaccination status, that's not a problem. The employer need take no further action, but must enforce the physical distancing and facial covering requirements without regard to the exemption. Oregon OSHA does expect employers to comply whichever option they choose, whether they allow the vaccination exemption with verification, or whether they simply continue to apply the facial covering and physical distancing requirements that have been in place now for many months. We recognize the challenges for employers, and particularly for public-facing businesses. However, employers have long had responsibility for enforcement of rules aimed at protecting their workers from on-the-job hazards, and that's what we're talking about here. We will be addressing issues regarding these requirements as necessary, and that includes using our existing enforcement tools. But we also have resources other than enforcement. On OSHA.oregon.gov, you can contact our technical experts who can help employers understand how to apply requirements in the specific workplaces they're talking about, as well as consultation services, which can help employers with their health and safety programs. With both of those resources, there's no risk of either citation or penalty. They are free, they are no fault, and they're no hassle.
Thank you very much, Michael. And we're going to, thank you very much for both of your introductions. We'll now open it up to questions. This is a reminder that this is a live Q&A on updated face covering guidance, so we won't be taking questions on other topics. Again, to ask a question, please submit it in writing to the chat section. Our first question comes from Matt, and the question is, doesn't it violate HIPAA to ask for private health information?
Well, thanks for that question, Matt. This is a question we have been getting quite a bit, so I'd like to address this, and thanks again for asking. So HIPAA stands for the Health Insurance Portability and Accountability Act, which was passed in 1996 nationally. That act protects the privacy of an individual's health information. So HIPAA does not prevent businesses like grocery stores, restaurants, bars, other businesses in Oregon from asking and verifying that customers are vaccinated for COVID-19 before allowing them to enter without a mask. Some suggest that a store clerk even asking customers at the door if they're vaccinated is a violation of HIPAA, but HIPAA really only comes into play when you have somebody like a medical provider who's disclosing information, medical information about an individual to a third party without written authorization, or otherwise is failing to protect private medical information. HIPAA doesn't apply to an individual or to a business outside of healthcare. It doesn't give someone protection against ever having to disclose their own health information. But in this case, I have to emphasize that it is your choice whether to provide that information or not. So if you don't want to share your vaccination status with a business, that's your choice, and you just would need to patronize that business wearing a mask. And so again, it's really a question of a personal choice. And the reason that we're asking for this verification is that unlike most medical information, your vaccination status does affect other people because they need to know that they're protected because you're protected against COVID-19. So I hope that helps answer that question.
Thank you very much, Dr. Jeanne. Our next question comes from Tom. Do national employers who have their own corporate policy around asking for vaccination status have to follow Oregon guidance?
The short answer to that question is yes, they do. Now they can make choices beyond that guidance, but when it comes to meeting the minimum requirements of the guidance, the requirements that both Dr. Jeanne and I have just described, national employers who are operating in Oregon need to follow the Oregon rules.
Thank you very much, Michael. Our next question comes from Karen. Can vaccinated parents transmit to their unvaccinated kids? And if so, should parents continue wearing masks even when without their kids in order to protect them from transmission?
Well, thanks for that question, Karen. It's an excellent question. At this point, we are seeing very little evidence of transmission from people who are fully vaccinated. In other words, we're not seeing spread from people who are fully vaccinated to others of COVID-19. So the risks are thought to be very low, and that would even apply in a household setting from a parent to a child who's unvaccinated. The CDC has determined that there's a growing body of evidence that fully vaccinated people are less likely to have an asymptomatic infection and therefore potentially less likely to transmit the virus to others. So this research is ongoing, but the science to date is very reassuring. And I don't think that a fully vaccinated parent really needs to worry about wearing a mask around their children in general for that reason.
Thank you, Dr. Jeanne. Our next question comes from Janica. The question is, how does Oregon justify being the only state in the nation to require a vaccine passport or approving vaccines going directly against the recommendations of President Biden?
Well, first of all, I think it should be clear that this really isn't a vaccine passport. It's not something that you have to carry in order to obtain services. You need to be prepared to provide verification of your vaccination status if you choose to ask a business to relieve you from the existing requirement to wear facial coverings and to social distance. And I'd like to point out that There are several other states that continue to enforce that expectation without giving businesses and individuals the option of verifying vaccination. Oregon OSHA sort of chose a middle ground here. We still expect the facial covering requirements to be followed, but we're also allowing individuals of all sorts to have the choice about whether or not, in the case of a business, they want to offer the vaccination exemption, and in the case of individuals, whether they want to take advantage of it.
Thank you very much, Michael. Our next question comes from Debbie. Why are you not following the honor system that Washington and California have?
I can take that one. So yeah, it's true that Washington and California have more of an honor system approach to vaccination, and there are certainly pros and cons to other approaches. As Administrator Wood just highlighted, there is choice at multiple levels in our current system. The business can choose whether or not they want to verify and allow people who are fully vaccinated to come in without a mask, and the individuals can choose whether or not they want to share their proof of vaccination to go unmasked, or if they just want to wear a mask. The issues with an honor system are that people may not have confidence that others who are going around unmasked are actually fully vaccinated. So there is a higher level of risk there. So it's something that we'll continue to evaluate, but currently Oregon has opted to go for this system with the choice on the part of the business to verify or not.
I might add to that unless there's been a very recent change, the state of California is not going with the honor system. They're actually one of the states that decided to leave their facial covering requirements in place and to not allow the vaccination exemption.
Thank you both. Our next question comes from Kim. How does a business know a vaccination record is legitimate? What about a foreign traveler? Is there guidance on this for those who don't want to verify vaccination status of the public?
I can take that one. So as I mentioned earlier, a business does not really, they don't need to try to authenticate. They need to make sure that somebody provides what we have defined as proof of vaccination, and that's been pretty clearly defined in the guidance as a CDC issued COVID vaccination card, a copy of it, a picture of it on a phone, or some other record from a healthcare provider that shows that you received a full vaccine series for COVID-19. Now, it's a good question about international vaccines. I'm not sure we've specifically got information on this yet, but I would say that if somebody has received a vaccine in their country that the World Health Organization has authorized for COVID-19, and they have a proper record of that from the country where they received the vaccine, that would be adequate for proving vaccination status in Oregon.
Thank you very much, Dr. Jeanne. Our next question comes from Bobby. What about people that have already had COVID? I read they don't need to be masked or vaccinated.
Great question, Bobby. So I think what you're getting at is that people who've had a COVID-19 infection, we know they likely have some immunity to reinfection. So in other words, the infection helped their immune system recognize the virus and develop antibodies, so they're less likely to get it. Now, that said, it looks like the vaccines that are authorized in the US are so effective, they may actually be more effective than the so-called natural immunity that you would get from an actual infection. So the CDC and OHA recommend that anybody, even if you've had COVID and it was confirmed by a test and you've recovered, you should still get a full vaccine series for COVID-19. There is no risk to you from getting that, and if anything, it might give you even stronger immune response than for somebody who didn't have the infection. But it's absolutely safe to get the vaccine if you've had COVID, and it's really important for full protection that you get the vaccine.
Thank you very much, Dr. Jeanne. Another question from Anna. What qualifies as a clinic, as mentioned by Tom when noting places fully vaccinated individuals still need to wear masks, such as public transportation and long-term care institutions?
Yeah, that was, I think, referring to hospitals and clinics. So that would be generally any kind of healthcare type clinic, and that would include mental health, behavioral health. It would include a lot of things other than just primary care clinics. I don't have a full list for you, but it's a pretty broad definition of clinic in terms of healthcare.
Thank you, Dr. Jeanne. Our next question comes from John. When do we plan to open public transit to these same guidelines?
That's a good question. I'm not sure we have a timeline for public transit. Transit is a setting where you come in contact potentially with a lot of different people, and so that's why we've highlighted physical distancing and masking as still very important. And in the current CDC guidance, it's still listed there. Again, we are continually evaluating evidence and data in terms of transmission in various settings. And so we'll continue to reevaluate those requirements and recommendations.
Thank you, Dr. Jeanne. Next question comes from Katie. Does the updated mask guidance exempt all outdoor activities from requiring masks, including venues and outdoor entertainment?
Yeah, so that's a good question. Outdoor activities, outdoors in general is a much safer place than indoors in terms of transmission, and that's because of the ability of the virus to be airborne and the importance, therefore, of fresh air and good, clean ventilation. So outdoors is inherently safer than indoors. In terms of the requirements, just to reiterate, even people who are not vaccinated can now be outdoors without masks as long as they are in uncrowded spaces and they're not in large gatherings. And that also goes for people who are at higher risk for COVID, who are vaccinated. So I think it's going to depend on the specific situation for venues and outdoor entertainment. But for example, a large concert with a lot of people that would count as a crowded space. And so somebody who's not vaccinated would need to wear a mask. And if that venue is checking for vaccination status, then those people could be allowed to be there unmasked. But again, if you're unvaccinated in those settings, you would need to wear a mask.
Thank you, Dr. Jeanne. Our next question is from Teresa. Will mask mandate be lifted once 70% are vaccinated?
Good question. I don't think we know the answer to this. I think there's a lot of discussions happening at the state level right now about what will happen at the 70%, but I think that's certainly one possibility. The governor has signaled her intention to really open things up a lot more and lift a lot of the restrictions once we hit 70%. The risk level system for counties will go away, and a lot of those requirements, which we know are pretty burdensome on many businesses and many communities, those will be significantly lifted. So I think that's entirely possible, but I think it's, I can't speak on behalf of the governor and the way things will go.
Thank you, Dr. Jeanne. Our next question is from Wendy. If I go into a business that requires masks, but I have my vaccination card and show them, can I continue to do my business there without my mask?
Yeah, that's a good question. And the real answer is it will be up to the business in that situation. The way the guidance works, there are basically two choices. The business decides whether or not to provide the option of vaccination verification and the removal of the mask. And then the individual chooses whether or not to exercise that option. If a business decides to simply enforce the facial covering requirements, then an individual can't insist that they go unmasked in spite of the business's decision.
Thank you, Michael. Our next question is from Kim. What is the guidance for public parades, e.g. a 4th of July parade?
Okay, well, thanks for that question. I think it's going to depend. Again, a parade is typically going to be outside, so that's safer. But typically a parade might have a lot of people. And so I think if the parade can kind of ensure that there's people are spaced out, potentially people could be there without a mask. Again, this is kind of a gray area because it's a crowded, larger gathering. And so in general, if it is crowded and people aren't spaced enough, we want people wearing masks, at least those who are unvaccinated. Now, the other thing is who's organizing the parade, and are they able to verify vaccination status for people participating in the parade to say it's okay for you to not wear a mask? That gets a little challenging. So I understand that. So I don't know that we have a blanket answer for this, but the safest thing would be for people to keep physical distance, and people who are unable to do that, or if they're concerned about it, should wear a mask.
The other thing to be aware of is these requirements may well change, and that certainly makes it more challenging for venue planners, but it doesn't make sense to put them in place now and leave them in place without regard to the science, simply so that things can be predictable. So, the answer may be one thing for the 4th of July. It may be more restrictive for a Flag Day parade in the middle of June. But if we're talking about a Labor Day parade, it's possible that most of the restrictions will be gone. And so operating with a little bit of flexibility as you develop your plans for those events is probably useful.
Thank you, Michael, and thank you, Dr. Jeanne. Our next question is from Terry, and it's an OSHA question. Do the rule changes for the public announced by the CDC and OHA apply to healthcare facilities, medical and dental offices, or are they still the same as before the CDC and, the CDC and ODA changes?
I think you're correct, actually, that they meant to say OHA, although it said ODA twice. They may be talking about guidance from the Dental Association. The basic information is that the Oregon Health Authority guidance is different for healthcare facilities, and that is still what we would be looking toward in the context of enforcement. And then there are some specific requirements related to personal protective equipment that have nothing to do with the facial covering or distancing requirements. And so they aren't affected by any of the changes we're discussing here.
Thank you very much, Michael. Our next question is from Rachel. Can you verify vaccination status of employees and allow them to be mask-free, but continue to require mask wearing from customers that come in?
Yes, you absolutely can. It doesn't have to be a single decision for all customers and employees. You'd probably want to make sure that you could clearly explain to customers why you were doing that, because it's much easier. It's much easier for you to verify the status of your employees and to maintain that. You also can actually distinguish between customers. For example, some retail operations also offer classes, and I can certainly envision that sort of operation not offering the vaccination exemption in its general retail, but providing it when people sign up and attend classes. So there really is a lot of flexibility around how you can structure this, as long as you operate with the understanding that you can't exempt people unless you verify their vaccination status.
Thank you very much, Michael. Our next question is from Sherry. Do you know if schools are still going to require masks in the fall?
Well, thanks, Sherry. I think this is a $1 million question that a lot of parents, students, teachers, and schools really want to know right now, as soon as possible. The answer is no, we don't know, but we hope to know pretty soon. In the next few weeks, we're expecting the CDC to issue their new school guidance, which we will be taking into consideration, OHA and the Oregon Department of Education, as we craft what guidance will look like for the fall. I think it's fair to say that in general, guidance for the fall for schools is going to be significantly less restrictive than for the past school year. I can't answer yet, though, the question about masks. Masks are a pretty important layer of protection. So even if we're lifting and reducing some of the other restrictions for schools, they may still be a pretty important thing that we need to rely on to allow schools to operate in person and have normal class sizes and things like that. So stay tuned. I do expect the guides to be out early this summer so that schools and parents and everybody can be planning for fall.
Thank you,
Dr.
Dr.
Jeanne, I actually want to piggyback on that question a little bit. Do you think there's a possibility that there'll be a distinction in the requirements depending on whether the school building has a ventilation system as opposed to using radiant heat?
Yeah, well, ventilation is, we've learned over the past year that ventilation is actually a really important preventive measure for COVID-19. Unfortunately, many schools don't have the ability to significantly improve the ventilation in older buildings. So I'm not sure we know the answer to that, but ventilation is one of those many layers, and it's an important consideration for schools for sure.
Thank you, Michael, and thank you, Dr. Jeanne. And this is our last question from India. Will businesses be required to check people on the floor to make sure they're masking if they're not fully vaccinated?
No, we would not expect that. If you've developed a system to do verification at the point of entry, then you're going to have to realistically rely on people not to break the rules once they've entered. You know, there may be exceptions to that if you're talking about a business that literally has 2 customers in the store at a time and you see somebody take off their facial covering, then you probably should do something about it. But certainly a large store where you can't keep track of people within the aisles, you don't have to keep checking with the same individual to see if they're vaccinated. That goes beyond what can reasonably be expected.
Okay.
Thank you. And that was our last question that we were taking. And I'm going to now turn it over to Tom for some final remarks. To Dr. Jeanne for final remarks.
Thank you. Yes, thank you all for participating in the Facebook Live discussion today. Some really great questions from all of you. We want to encourage every Oregonian to get vaccinated. Vaccines are now widely available statewide from multiple providers. They are safe, they're highly effective, and they are our clearest path out of this pandemic. So for those who are vaccinated, thank you for taking the steps to protect yourself and those around you. For those eligible who aren't yet vaccinated, please make a plan to talk to your healthcare provider if you have questions. Only together can we continue to drive down COVID-19 in Oregon. You can check our website where we provide information in multiple languages to address questions about COVID-19 and vaccinations, and provide the facts to keep you healthy and informed.
Thank you once again to our providers and to everyone out there who joined us today for our Facebook Live discussion on OHA's new mask guidance. Have a great rest of your day.